Mais c'est vraiment une réalité que plusieurs personnes au Canada n'ont pas accès aux services dont ils ont besoin. Donc, la réalité, c'est, si on parle de soins dentaires, il y a 4,3 millions de Canadiens qui n'ont pas accès à ces services essentiels. Parce qu'on sait, les soins dentaires sont essentiels pour les soins en général. D'être en santé, ça dit qu'on a besoin des soins dentaires. Donc, c'est tellement un dommage, c'est tellement triste que plusieurs Canadiens n'ont pas accès à ces services. Donc, j'ai parlé aujourd'hui avec Mélodie et Michel. Ils ont partagé leur histoire. Le fait qu'ils gagnent un salaire, mais ils ne peuvent pas, malgré tout ça, ils ne peuvent pas payer pour l'assurance privée. C'est trop cher. Les soins des dentaires sont trop chers, quand même pour quelqu'un qui gagne un salaire qui est assez bien. Donc, on va changer ça. We see too many Canadians in our country that cannot afford dental services. There's 4.3 million Canadians that don't have access to dental services, have no coverage, public or private. We know that 1 in 3 Canadians have no coverage at all. This is a serious concern. Cost of living is going up. It's harder and harder to make ends meet. And then we look at the choices that we have. Mr. Trudeau thinks that things are fine the way they are. Mr. Trudeau and Mr. Scheer have a track record as Liberal and Conservative governments of helping the well-connected and the powerful get ahead while everyone else falls behind. That is wrong. Government should work for people. We should be in it for people, and that's what we're presenting to people. We are in it for you. We are in it for people. We're fighting for you. We're on your side. And that's why today I'm really proud to announce in our past, Tommy Douglas had a vision of Medicare, and that meant care for everyone, head to toe. And he talked about something, and I want to bring that idea back. He talked about Dentacare, that not only do we need pharmacare, medication coverage for all, but we also need to make sure that no Canadian falls behind when it comes to their dental needs. And that's why today I'm proud to say our plan that we're putting forward is Dentacare. It'll cover everyone who has salary less than $70,000. They'll be completely covered with this plan. And those who make between 70 and 90 will have a sliding scale. But this is our first step toward the dream of universal Dentacare for all. We're taking the first bold step today so that people like Melody and Michelle will have coverage. This is a plan that is direct. It's a government insurance plan, and we'll ensure day one we put this in place and we have coverage for every single Canadian who makes less than 70,000 who does not have coverage. This is a bold step forward. Donc, ce qu'on va faire aujourd'hui, c'est d'annoncer qu'on a un plan, le premier pas pour s'assurer qu'on a un soin dentaire universel. Le premier pas, c'est de s'assurer avec notre assurance publique, c'est de donner de couverture pour chacun qui gagne moins de 70 000 $. On va avoir la couverture, donc les gens comme Mélodie et Michel, ils vont avoir la couverture. C'est le premier pas envers un système universel. On va commencer tout de suite et on est tellement fiers de ce plan parce qu'on va aider des gens avec ça. Merci beaucoup. And now we'll take some questions from the media.
Good morning, Abigail Beeman, Global News. How much will this cost?
So we've had this costed by the Parliamentary Budget Office, and the first year will be about $560 million. There'll be a bump up in the second year because we anticipate, or the Parliamentary Budget Office anticipates, there'll be a lot of people who have not had access to dental services that'll then take advantage of a program that'll help them get back on track. So there'll be a bump up, and then it'll stabilize around $860 million is what the Parliamentary Budget anticipates it'll cost.
Yeah, sorry, follow-up being, and what will you do to pay for that? That's a lot of money. Where will that money come from?
Again, it's about choices. $860 million to assure that 4.3 million Canadians have dental services is a priority for us. What's not a priority is what Mr. Trudeau did last year. Cut corporate taxes, basically gave $14 billion to the wealthiest corporations so that they could buy corporate jets and limos. He spent $14 billion to do that. This plan costs less than $1 billion. He spent $4.5 billion in buying a pipeline. This plan costs $856 million. He spent billions of dollars. He waived corporate loans to the tune of $6 billion in 1 year alone. This plan costs $856 million. I mean, these are choices that we would make. This is a priority for us. We know that Canadians deserve the care. We're going to make that happen.
Yesterday, you made an announcement on affordable housing and said you'd provide about $5 billion in the first year and a half. Today, you're saying $560 million. What do you say to Canadians who want the books balanced and are concerned that the NDP platform will cost too much?
Well, the difference is we're not going to give billions of dollars away to corporations, the wealthiest corporations that don't need help. We're making a clear choice. We have limited resources. We understand that. We would not give $14 billion to the wealthiest corporations to buy corporate jets. We just won't do that. Instead, we'd invest in people. That's the big difference. It's a matter of priorities. There is limited resources, and people expect us to use those resources responsibly. We will not give them away to the wealthiest, but invest in people.
What is the direct impact you think that this plan will have on Canadians?
It'll make people healthier. It'll mean that people like Melody and Michelle, who told me that they're earning a decent salary, but they can't afford the care that they need, that they're putting it off and it gets worse and worse, that people who are struggling because they can't afford dental care won't have to struggle anymore. This will mean so much to so many people, and I'm proud that we're putting this forward.
Monsieur Singh, bonjour. Christian
Bonjour.
Noël, Radio-Canada. J'essaie de faire le calcul de combien vos promesses vont coûter. Pour le moment, j'arrive à presque 20 milliards de dollars, puis ce n'est pas tout qui est encore dévoilé. On a un déficit de 14 milliards de dollars présentement, donc avec vos promesses, on serait à 34. Comment est-ce que vous allez convaincre les Canadiens que vous ne serez pas un gouvernement dépensier?
Donc, c'est parce qu'on parle des revenus aussi. On parle de comment on peut mettre en œuvre un impôt sur les super riches. On parle de comment on peut arrêter les paradis fiscaux. Ce sont des milliards et des milliards de dollars que les libéraux ni les conservateurs ont le courage d'agir, le courage de régler. On a le courage de dire non aux corporations qui sont, aux entreprises qui sont les plus riches et dire oui aux gens.
Rapidement là-dessus, vous espérez équilibrer le budget en combien d'années?
Comment?
Combien d'années pour équilibrer le budget? 3, 4, 5?
Donc, ce qu'on propose, c'est des investissements pour monsieur, madame, tout le monde et des revenus pour ceux qui ont les moyens de le payer. Donc, les gens qui ont des fortunes de plus de 20 millions de dollars, les plus grandes entreprises, les paradis fiscaux, on va augmenter notre financement et on va dépenser pour les gens.
Pour l'annonce ce matin, si vous me permettez, à quel point, pour les gens de Sudbury et pour les Canadiens aussi, ne pas avoir de l'argent pour les soins dentaires cause des problèmes de santé et des problèmes, peut-être même aussi des problèmes financiers et de dépendance? C'est
exactement ça. Donc, à cause du manque de services dentaires, au manque d'accès aux services dentaires, ça crée des grands problèmes de santé. J'ai parlé avec plusieurs personnes. Mélodie, en fait, elle travaille dans un milieu où elle parle souvent avec les gens qui n'ont pas accès aux services dentaires à cause de ça, et où elles perdent les dents. Et c'est difficile de trouver un travail si on n'a pas des dents. C'est un grand enjeu. Les gens font face des difficultés de sortir dans la vie parce qu'ils sont embarrassés, en fait, à cause des manques des dents. Donc, ça crée des problèmes économiques, ça coûte trop cher et les problèmes augmentent. Si on a des problèmes avec le sang dentaire, ça veut dire qu'on a des problèmes de santé aussi en général. Donc, c'est tous connecté. Le rêve de Tommy Douglas, c'était si on veut donner la couverture, il faut avoir la couverture complète. Et ça inclut aussi les dents.
Good morning, Mr. Singh. Hannah
Good morning.
CBC News.
Good morning, Hannah.
So if you were elected on October 21st, I'm sure there's people sitting at home saying, oh, I'd love to have some dental coverage. How would it specifically work for them? When would they be able to go to the dentist?
Sure. Yeah, this is a plan we'd put in place year one. This is a plan that doesn't require we will work with provinces, of course, always, but this is a government insurance plan. Essentially, we're delivering a federal government insurance plan to cover those Canadians who have no coverage. That is an immediate plan. That will immediately lift 4.3 million people out of the position where they have no public or private insurance. This is an immediate solution. It is bold, it is exciting. I'm kind of getting goosebumps when I think about it, because we can actually cover so many Canadians that don't have coverage. This is such an amazing step forward, and it's really a matter of choice. I gave you all those examples for a reason. The $6 billion that Mr. Trudeau waived for corporate loans, the $14 billion that they gave to the wealthiest corporations to buy corporate jets. It's really a matter of priorities. Our priorities will always be people. We're in it for people, and this is something that's going to lift up the lives of people.
So would be, say, a couple months, and then people would be able to go to the dentist? Is that kind of what I'm hearing?
Yeah, this is something that we could put in place pretty immediate. This is something that we expect people will be able to use within the first year of our government mandate. And this is something we expect people will use very much so in the second year as the program rolls out and more people use it. And that's why the Parliamentary Budget Office put a massive bump up for the second year, and then it'll stabilize because we expect people to use this program. We know people are putting off their needs because they can't afford it, and we want people to have the dental care they need.
And then if there was a minority government situation, would this be a plan that you would push whoever was in power to put forward?
Absolutely. When we're in the position to implement this, if anyone wants to work with us to make it happen, we're going to make this happen. Pharmacare for All and Dentacare, these are our two massive commitments. We are really excited about these two commitments. We're going to make this happen. Oui.
Vous dites c'est le premier pas vers l'assurance dentaire universelle.
Oui.
Pour le moment, ça s'applique seulement à ceux qui font 90 000 et moins. Combien de temps vous croyez que ça va prendre avant que ce soit universel?
Bonne question. Donc, ce qu'on propose, c'est exactement ça. Ça va être complètement gratuit pour les gens qui gagnent 70 000 ou moins. Et on va avoir un peu d'argent pour les gens qui gagnent entre 70 000 et 90 000. Donc, entre ce montant, ils vont avoir des couvertures, pas exactement complètes, mais des couvertures aussi. Donc, c'est notre rêve, c'est vraiment un système universel. On va commencer avec ce programme et donc on va continuer envers un système universel, mais ça, c'est le premier pas.
Et donc, combien de temps avant que tout le monde y ait accès, même au-dessus de 90 000?
Oui, donc on va commencer avec ce plan et donc on va voir comment on peut l'augmenter, mais pour le moment, on a prévisé ce plan pour le court terme. Merci.
Heidi Ulrichsen, NorthernLifeSudbury.com.
Hi there.
Hi. Have you considered the impact on the small business people that essentially dental offices are? They employ people. Have you spoken to the Ontario Dental Association, the Canadian Dental Association? For example, the Ontario Healthy Smiles program does not
Yes.
even cover the costs of dentists. So are you going to make sure that, I guess, dentists are able to cover their costs with this new, I guess, coverage for Canadians and consider the impact on small business people?
A great question. Healthy Smiles is a great program, but I've spoken to dentists who want to be involved in the Healthy Smile program, but it doesn't pay enough for it to even cover the cost. So it is a serious problem. What we're hoping with this coverage is we're going to take off some of the burden from provinces. With this coverage, it's a federal plan. We're putting up all the dollars federal. There's no provincial investments, and it's going to put a lot of pressure off of the provincial system. And then we want to sit down and negotiate with provinces that because of our program, it's going to lift the cost off of provinces in such a massive way that we want to negotiate to increase funding for the provincial programs that do exist. We don't have control over those provincial programs. They are good starts, but they don't go far enough. And the Healthy Smiles is a great example of a great program that doesn't pay enough in Ontario. So what we want to do is by putting in place this coverage, that's actually going to create a great it's going to make a massive investment. We're hoping that that'll offset some of the costs, and so provinces can augment and increase the funding that they do put in to programs like Healthy Smiles and other provinces that have similar programs.
Hi, Shannon Proudfoot with Maclean's.
Hi, Shannon.
Let's say in a hypothetical minority government situation, if you were to press for some of your priorities to be incorporated, what would be your one or two top priorities of the platform planks you've announced so far, assuming you're not going to be able to get the whole package of what you want? What would you pursue first?
Sure. So we would take, so first off, I'm running to Prime Minister. So I'll frame it like, as Prime Minister, I will take the support of other parties in a minority government while I'm Prime Minister. I'll receive their support for the following. One, I will take people's healthcare very seriously. And healthcare is a priority, so pharmacare and dentacare. We'll take people's budgets very seriously, and there's a number of no-cost steps, taking on the big telecom, putting in a price cap, and requiring mandatory unlimited data plans. That's a low cost, no cost actually, and that's going to save Canadians a lot of money, bring us in line with the OECD countries. Housing, massive investment that we need to make because people are struggling with the cost of housing. And then with respect to the environment, we'll tackle climate crisis and make some massive investments there. Those are our three areas where we're seriously concerned and we're going to put a lot of effort into. Thank you. I got the thumbs up and then I got you. but I'll go with you. That's okay.
Just one quickly
Yeah,
before
go
we
for
go. Over the past week, the gap between the NDP and Greens has in fact widened, and you've gained 2 points. However, still to get to a position that is in good shape for the NDP, you still have a long way to go. What are your thoughts on that, just in the past week, and how you continue to take back your Green support?
Well, I mean, my focus is Mr. Trudeau. I'm not worried about anyone else. I'm trying to replace Mr. Trudeau because people deserve a government that works for them. Mr. Trudeau hasn't done that. He hasn't had the backs of people. Shout out to Charlie Angus. He hasn't. He's made it a priority to make life easier for the wealthiest and make their life easier while it makes everyone else's harder. I want to replace that with a government, with a new democratic government that's in it for you, that's in it for people. That's what we got to do. Merci beaucoup. Thank you so much. Thank you.